Hi, this is Dr. Walker, and welcome back to the channel, denwalker.com. Today, I just thought I'd talk a little about some things happening with specifically ivermectin and its utility in several countries. So, if you look at Japan, for example, I believe they started using prophylactically ivermectin about the 8th of August. What you'll see is that there is sort of a continued increase in the numbers, but in the next few weeks beyond that point, the numbers almost, not zero, but very, very close to being sort of as low as you can imagine. I think recently there's only sort of one COVID death in the last day or two. And then I had another listing I did about a week ago looking at India, sort of the same thing. India started using ivermectin prophylactically. I believe it was the second week of May, and sort of the same thing again. The numbers essentially dropped off to not zero, but very, very close to zero. Other countries as well. There was Nigeria, was another country, and again, what happens? Ivermectin again is not. To be clear, not FDA approved, but for the countries who have missed that memo and have gone ahead regardless and are using ivermectin, the numbers are falling off now. Yes, ivermectin is not FDA approved, as I said before. It is not indicated for COVID-19, but again, initially, beta blockades was not indicated for heart failure either, but we found out subsequently that beta blockade can be used in heart failure patients. In fact, people who were on beta blockades actually did a little bit better than those that were not. Again, sort of the same thing with ivermectin. Although not approved for that indication, what providers are finding out is that those folks are doing better than some other options. And as you well know, in our current atmosphere, there is no treatment for COVID infection once you have it. So in some facilities, they're still asking you, did you get the vaccine? If you did not get the vaccine, then somehow you're a second-class citizen, which, again, not something I would ascribe to. But, right, there is no treatment for it. The leaders of this country has not said, well, try this or do this. They've said nothing to that regard. So, essentially, is if you were to get the infection, then you're on your own. And traditionally, what happens in this pandemic, if you were to get a COVID positive test, you were then sent home, essentially saying that do not come back until you can't breathe. And once you can't breathe, that cytokine storm is already set in. And so you're way behind the curve. So the whole conversation that I've been trying to push a little bit is to remind folks that consider other options. I know some folks are still thinking about the vaccine and those, and again, that should be a personal choice, as I've said before. But as you're still thinking, as you're looking and wondering, or you've had the vaccine and perhaps you had a breakthrough infection, those are the things that I think you should be talking with your provider, your doctor about, to say to them, if I were to become infected and required hospitalization, is there a plan that you have for me? So in other words, are there things in your arsenal that you would not mind using that may help save my life? That is a question for you and your provider, to ask them that same question. If the answer is no, there is no treatment once you get COVID, then I would beg almost that you find yourself another provider who have other options in their arsenal, other things that they can think about, like ivermectin, for example. I've been talking about quercetin for a while now. That's one option. That's one option. That's an over-the-counter option that oftentimes it does not require prescription. Ivermectin, though, if your provider is going to give that to you, then it's often times a prescription, or there are other options in terms of people getting ivermectin from India overseas. I do not have yet a definite good source for that. But again, that's a discussion for you and your provider, your doctor. And again, most of the side effects from ivermectin, some GI upset. 3.7 billion doses used since the inception. And again, for the most common things would be some belly upset, diarrhea, that sort of stuff, and that's really it. The discussion point have been, and again, you well know this, that ivermectin is used essentially as a horse pill. Clearly not so. Clearly not so. When most of us doctors went to med school, we learned ivermectin typically as treatment for onchocerciasis or head lice or scabies, that sort of stuff. Not in med school, not as a horse pill. So the point is, look at options in terms of taking care of yourself, just in case something untoward would happen to you. You have an avenue of saving yourself, saving your own life. Vitamin D, again, is another great option. I've been talking about that now for a while. Folks are asking quite often, how much vitamin D do you take? Lots of information still coming out. I've been telling people 2,000 microunits per day. However, recent data came out and said that your numbers really should be upwards of 60 plus. And I would recommend, in fact, higher than that, especially coming up on the winter time. More like 80 or 90 micrograms per milliliter. That is what I'd recommend. So that would take many folks upwards of about 10,000 units, they would say, for a couple of weeks, and then get your levels checked in maybe 6 or 8 weeks to see where your numbers are. And again, you should be 60 to 80 micrograms per milliliter. If you're not there, then continue taking that. So the thought was to take 10,000 IUs daily for about 6 to 8 weeks, get your levels checked again. If your numbers are adequate, i.e. 80 to 90 thereabouts, then you can throttle back to utilizing probably 5,000 IUs per day. But again, check with your doctor, get your levels checked and see where they are. That also is very, very, very important. I haven't seen anything yet where someone had adequate vitamin D levels who was hospitalized for COVID and, God forbid, died from COVID. I've not seen that number. I'm looking daily for that sort of stuff. I've not seen that yet, and I've not heard Dr. Fauci talk about that to that regard. I'm not certain he's looking at that, but I have not seen that number. But people who have been hospitalized with COVID, they're usually vitamin D deficient. So they're typically very, 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 very low levels of vitamin D, and they're not supplementing themselves at all. And it depends on where you live in the country. Not getting adequate sunshine, obviously, decreases your vitamin D levels. So the point of this video is to kind of give you talk about some options, talk about some things that you should be doing yourself, vaccinated or otherwise. Vitamin D, quercetin, ivermectin, talk with your doctor about that specifically. Again, ivermectin is not FDA approved for COVID. I get that. However, neither are lots of other medications not approved for that specific cause, but we still use them because we see that there is significant benefit for some in those for some of those things. So anyway, talk with your doctor, look at some of these things I'm talking about, and you can always IM me. IM me if you need to with specific questions, and if I can answer them, without too much. Some folks are asking questions that I can't with good conscience answer online, not knowing much more about you and your history, which again, I'm not trying to do that. But if it's a straightforward question like how much vitamin D do I take, for the most part, most people can easily take 2,000 IUs per day. Most people would recommend 10,000 IUs until you get your levels up to par, as I said before. But do what you can to take care of yourself in this pandemic until we get over this. I'm hoping that in the next year or so we should be seeing the end of this. But that's with all of us doing our own part, taking care of ourselves, and hopefully we'll all get through this at the end of the day, end of the time. Anyway, thanks for listening, Dr. Walker. Take care. God bless.